Hey guys, welcome back to Baker Health Talks. I'm your co-host Mo. In today's episode, we interviewed Maria, who owns a med spa in Montclair. Today's episode, she's going to be giving us some great tips on how you can improve your self-care and how potentially bodywork therapy can work for you. Stay tuned.
We're very excited to have our guest today. It's a guest that actually, in talking before we started taping, we have a lot of personal overlap in terms of our journeys. And then from a professional standpoint, there's a cool perpendicularity now because people know the Baker Health journey is we're kind of taking the good parts of traditional healthcare, but shifting to more modern holistic care. And my guest today, Maria, that's where she sits. It's probably I don't want to speak for you, but 5, 6, 7 years ago, it maybe wouldn't fall under healthcare. And I think today, where things have shifted, you're very much what I consider healthcare. And there's probably no more important part of healthcare than self-care. And the when I was in school and residency and training, healthcare was something that was done to you. The doctor would give it to you, whether prescription or procedure or surgery, right? You're almost a victim of healthcare. Now, the best healthcare is what you do for yourself. And that's mental health, physical health. And I was very, very impressed with I'll call it a portfolio of expertise. I don't know if I've ever come across somebody who does so many different things. And so I think it's going to be an exciting conversation. I can't wait to hear all the cool things and pieces of advice you have for folks on how they could take better care of themselves. I know you have a center in is it in Montclair?
In Montclair, yeah.
In Montclair, where we have a location in Clifton, but we
Mhm.
have 4 locations in Northern Jersey. And so our members can get the information for your site. Mo's going to put it at the bottom of everything. And I'd encourage all of our Baker Health members to give it a try, because I think you'll find it to be just as useful, if not more useful, than going to the doctor.
Mhm.
And so I'm excited to talk to you, but we'd like to start with just understanding your background, like where you started, your personal journey, your professional journey, and how you got to where you are today.
Absolutely. I thank you for having me on the show. First of all, this is a great opportunity. I really believe in preventative healthcare, and I do want to elevate the bodywork and massage therapy field by pursuing things that are going to elevate, holistic care, self care. So I decided I always grew up around family members who were doctors, cardiologists, and nurses, and that work with the heart. So I decided I want to go back to school during COVID, and I started my medical assistant training. So that was really just a career change for me. I learned so many things, and I enjoyed working with some of New Jersey's top doctors and also working in a med spa setting. So that kind of flipped the switch for me. And I said, oh, I want a med spa too. So I can do this. I have so much to give to the community, to give to families. I work with a lot of families, and I really I enjoy every moment and everyone that I meet. So yeah, that's kind of the start. I had a family start with really good examples, and I just decided, okay, I want to elevate myself and elevate the work that I do. People have their ideas on massage therapy. Some people take it very seriously that have chronic illness and disease, and other people on the flip side, they have their jokes. So for me, I find that I came to massage therapy wanting to help people with cancer, and specifically breast cancer. So just that kind of was the whole start of my journey, and it's been really incredible. Unfortunately, like, the state tries to hamper you on doing specific like breast tissue massage, but clients that need certain things and they ask you, what's your experience, what's your expertise, they are going to come to you for help. So I try to play within the rules, but I like to give my client exactly what they need professionally.
Yeah, for sure.
Yeah.
I could relate. I mean, um, I have yet in 17 years of taking care of families and kids, I have
Mhm.
yet to see one who I did exactly what I learned to help, right? The kids don't read the books, as we say. And so the background is just that, it's background, right? but each case that comes before you is specific.
Mhm.
And if it wasn't, then, you and I don't have jobs, right? We could be robots. A computer could do it. The reason we exist is because every case is different, and therefore every treatment plan or every approach has to be different. And that uniqueness not only gives better care, but that's what establishes a connection. So, and that's what makes it fun for us, right? So,
For sure.
can you? I know there's a lot of questions leading up to this conversation.
Mhm.
Mo is gonna go over those questions on specifics, but before we get to specifics, just further background. When did you start the Med Spa, and can you just go over some of the most common services you perform?
Absolutely. Yeah. So the med spa started about a year ago. And initially, it's funny, like when you start your business, you have your initial vision, and then that kind of transforms into something else and then elevates to something else. So that was the same case for me. Like I was like, okay, I'm just going to focus on my body work therapy
Okay.
for my clients because that's what they know me for and that's what's popular. And I'm booked constantly for that. But then it just elevated into, okay, I'm going to offer birth doula services as well. I have a lot of prenatal, postnatal clients. And you mentioned like the autonomy earlier and how healthcare just throws things on you. You're not given a choice. And I'm a fighter. Like ever since I was born, that's been my spirit is like, no, I have rights and I want to be treated a certain way. And I feel like I attract clients that are very similar and they want to be seen and heard. So I do that for them. And that's why they trust me and they keep booking, with me as well. And then what was the second part of your
What are
question?
the different services you offer?
And then the different services, they range. So I offer holistic bodywork therapy, of course, but
Can you define that?
oh yeah, for sure. Yeah. So it's looking at what the skill is already of massage therapy, but then enhancing it with using, um, let's say, I don't know. I just look at all the various aspects of it. What are the creams? What are the oils?
Oh, okay.
What are the sounds that I'm using? Like we're going to talk about sound bath, or am I helping my clients to like even get to the mindset of where they want to go with their treatment, and just rebalancing. It's really a whole idea of treating the entire body. So I'm not just doing body work. I'm not a psychologist, so I'm not going to be doing anything like that, but getting their mind to the right setting so that they're able to achieve the homeostasis that they were looking for initially.
And if I'm listening to this, because that sounds really appealing,
Yeah.
if I'm listening to this, is the typical client somebody who, you might say no, Z's both, but somebody who like has chronic lower back pain and they can't figure it out and they've done everything and they go to these doctors, or is it somebody who doesn't necessarily have something off, quote unquote, but just wants to, I don't know, take, you know, better care of themselves?
It can be either
Yeah.
or.
Okay.
Typically, it's rare that I get a client that's like, "Oh, I'm just here for just to feel better."
Okay.
It's typically rare, but what I'll find as I work on them is like, actually, there's something specifically that I've never found a client that I don't find something specific that needs to be
Okay.
treated, whether it is like chronic tissue inflammation in a certain area, or sometimes it is the mind. You know, unfortunately, fortunately, so I try to just stay within my lane of practice, of course, but also help them to achieve, touch on, I will ask a person, you haven't really been able to relax this whole session. Like, have you tried meditation? Like, I'm not going to teach you how to do it per se, but I could offer them like sound therapy because everyone learns how to relax in different ways for their body. So I try to touch on, a couple different things, give them a couple more different options to see, maybe we can alter something and help you achieve. I'm not going to give you the same thing over and over again if it's not working.
That's great.
Yeah.
And then, right before we get to some of the questions,
Hmm.
one thing I'm always fascinated by, because of the type of people we interview, meaning people who do unique things, the people who do unique things had to come about it in a unique way, right? So, 90% of the doctors, 90% of the massage people, the 90% of the whatevers, we don't, I don't want to say we're not interested in talking to them.
Hmm.
I'll just say, we know their story before we talk to them. Like, I don't need to talk to the guy who like works at a hospital, because we're looking for the folks that are doing something differently, right? Because that's what we want to bring to the viewers and,
Hmm.
and the listeners. And so those people like yourself generally got there because they have a unique perspective on things. And one of the things that I find is you have to be very bold and courageous to kind of step outside the traditional paradigm to do something unique.
Mhm.
And so I'm fascinated by the part of the story where you decide, all right, listen, I was doing this and this was like a safe job and a safe career and safe,
Right.
but I want to take this leap and I want to
Mhm.
do something really cool for people, but
Mhm.
that's risky, right? So you decide you want to open this med spa a year ago and do this thing and take like a left turn from your career. And you were rooted in healthcare, but you pivoted and you're your own business owner, right? Like
Right.
this is your
Absolutely.
that's a
Yeah.
big jump. Can
Yeah.
you, before we get back to kind of the clinical aspects, can you just talk about that part? Like how you said, okay, I'm gonna do this and where you
Mhm.
found the courage or inspiration?
Yeah, for me, I've always had a little fire and passion to have my own, and um I enjoyed all of the fields that I was in. Like I started in dentistry. So I love that field, but I said, am I really going to want to continue working in mouths for the rest of
Mhm.
my life? Probably not. Like if people weren't unfortunately smokers, then maybe I would have continued with that. But I was like, I reached my limit.
Yeah. Yeah.
But from that field, I pulled so much about like how the head and neck are tied together. So I
Mhm.
got to focus in a lot on the facial structure. I got to see incredible cases of like lockjaw, like
Okay.
in my in front of my face, like a person was just getting a routine cleaning and they had lockjaw for like 10 minutes. And I
Wow.
was like, that's before, I really was thinking about massage therapy. And I was like, wow, I'd like to help that person on a certain level. Like, what is a different way that I could help people? So I was always kind of considering that. And I always wanted to be my own business owner. So those are kind of little tiny things kept happening that made me think like, I can help that person in a different way.
And
Um,
in the early phase now of your business, what has been kind of the best surprise and what has been the worst surprise?
the early phase, at first, when I started this, I really did not, I can't say like I had a vision that was with clarity.
Mhm.
So the clarity was a gradual thing. So I think the uncertainty is the worst part.
Mhm.
Like, and you do doubt yourself. You're like, what am I doing? And where I am right now from when I started is like such a huge jump. And I'm like slightly addicted to risk. Like you said before, I
Me too.
chose this career because I was like, oh, this is
Yeah.
safe. But what I do is not like it's never boring.
Yeah.
Like if you're bored in what you're doing, it's just that's not where you belong. So um eventually you get courageous and you're like, I'd like to really show people what I'm made of and show them, the next level of what I have to offer. This isn't just body work. This is like so much more than that. Um
Can you I that term I I I almost keep it to myself because I think most people think it's a weird term.
mm,
I I think of myself as addicted to risk too.
mhm.
Um and it's a relative basis because I see people like who are paralyzed with anxiety on a professional basis. I'm not talking about personal because they can be two different things, right?
Right.
There's people who
Yeah.
have like no personal anxiety, and the
Mhm.
reason they don't have personal anxiety is because they avoid all risk professionally. Do you understand? So
Or in general.
or in general,
Right.
yeah,
Yeah.
yeah, it could be right in general
Mhm.
for sure.
Mhm. They don't want to
Um,
rock the boat,
Right,
so to
and I
say.
like to
Yeah.
like flip the boat upside down. I like to like say, okay, we're going somewhere that we're definitely not today. I
Right.
think a lot of people are like,
Mhm.
the only thing I want to make sure when I wake up is that today is going to be as close to yesterday as possible. When I wake up, it sounds like you're the same. I'm like,
Mhm.
how different can I make today than yesterday in a positive
Exactly.
way,
And
right?
you have to as well.
So
Like it
so
can't stay the same.
that's a unique that's where does that come from? Is it just you get bored easily? Do you
Yes.
have a gambling habit? Like
I do like to take my risks for sure, but yeah, I have to say I get bored quite easily. So I have been, dentistry was 7 years. And at the beginning of dentistry, I also went ahead and did my massage therapy. And then I was like, okay, maybe I'm not finding enough teachers. I need more masters to help me to
Hmm,
get to my next level. I
okay.
think I've always had that mentality because I started with general dentistry, then I went into periodontal
Oh,
specialty and root canal therapy. Like it just got more and more involved. I got deeper and deeper and deeper. So I worked with different variety of dental specialties. So for me, I've always wanted to like just be in that specialty niche, and so I created that for myself. Went into massage therapy. It does have its boring moments, and that's when you're starting to master something. You can do it with your eyes closed. So I get to that point, like, okay, so what am I doing next? That's my personality, is like, okay, I got bored with that. What am I going to do next? So then I went into, I had the opportunity, during COVID to take medical assisting. In college, I was going for medicine as well. So I've always just had a love for the human body and seeing how it's tied to the human brain as well.
That's great. That's awesome.
Yeah.
That's, I have a lot of parallels with you on that. And so, Mo, do you want to go ahead and kind of lob? I know a lot of the folks that knew who our guest was going to be wanted to ask a couple of cool questions.
Yeah, let's get into it.
Sure.
First question I have, someone asked, self-care has become such a buzzword lately. What does it actually mean? And is it worth investing time and money into it, like skincare, into things like skincare and massages?
You may have mentioned that earlier, but self-care is a preventative. That's the cool thing about today, is that I've seen now more than ever before, like younger people coming to take care of their bodies. They're willing to invest. They're willing to put out their money for a sports massage after their workout instead of I don't know what the new gaming system is right now. And I know the Xbox is not new, but they're willing. Yeah. I was like, are we back to PlayStation again?
Both.
Yeah. So people are more willing to, I'll get someone to get that for me on my birthday, but I'll go ahead and I'll do my massages for myself now. Like, people are addicted to feeling good.
Yeah.
So that's such a tiny thing, that people don't want to feel bad, people just don't. And they now see that this is more accessible, it's more affordable, and they're just like, oh, I'm just going to get a 30-minute, even if that's, something little, I'll do that for myself. So that's the cool thing about today, is like, it's not like 5-10 years back where people were like, that's a luxury, I can't afford it, it's too much. It's not like that anymore.
Right.
So it's an investment. It's an investment into yourself, and it's a way of preventing disease and illness.
Nice.
Yeah.
Next question we had, someone asked, I've been seeing cupping massages all over the place lately, but I'm unsure of the benefits. Do the marks last? And can you explain how it works?
Yeah. So cupping is super popular right now. I use it on pretty much all of my like NFL clients. So I find that the cupping massage, I think of it as like a reverse deep tissue massage. And it's also considered myofascial work as well. So it's a myofascial decompression, and it's used to treat musculoskeletal disorders of the fascia. So whenever your fascia becomes like tight, restricted, you're not getting blood flow, you're not getting to the energy, you're not performing, there's no energy. So this helps to kind of undo that, and you get a better range of motion, the stiffness has gone away. If you're an athlete and you have a clean diet and you're drinking your fluids and water, the marks will last for like a week, 3 days to a week typically. But if you've had an injury, it could last like maybe a couple weeks. So, I mean, the marks are there. I went to the grocery store the other day and this guy's like, are you okay? And I was like, yeah, I'm perfectly fine. Like,
so you get it done too?
I get it done all the time. Yeah.
But you can't do it yourself, right?
I technically can.
Oh, okay.
I mean, certain areas I can do it on
right.
myself, but yeah, I typically go to someone and they'll, I love acupuncture for my own personal self-care. So I've
never had acupuncture done.
You should get it done.
Tell me, like, what's the difference before and after?
Before and after for the muscle?
Yeah. Like, how do you feel after compared to before?
Oh my gosh. Like I have to tell you, I had like stuck hips for a while. I think whatever bed I was sleeping in was not great. And I couldn't find anything that was going to help me. And the cupping therapy, it just did the trick for me, like in 2 sessions.
Have you ever done
literally
cupping?
I've got cupping before.
You?
Yeah.
You didn't tell me that, really?
Long time ago. And I used to be an athlete.
He's keeping secrets. He's keeping
How was
secrets from you.
It was good. I liked it.
Yeah.
It like makes you feel loose.
Yeah,
well,
exactly.
It's like what
You're
Maria
like,
said.
Yeah, exactly. You know who gets cupping all the time? Sharon.
She's our wellness director.
Oh, is she?
Yoga and wellness director.
Yeah, she came to like we had a barbecue party last week for the whole company. She came in like a
Wow.
dress and like all her cupping spots are.
It's like, just want to show you my back, guys.
Yeah.
But you're right. I see when I watch
It's-
the NBA, because the
Mhm.
NFL you can't see there, but whenever I
Right.
watch NBA games, like
Like
there's
swimmers.
always an
Mhm.
athlete.
Swimmers love getting like
Yeah.
it's crazy, like their whole back.
All right, I'm gonna
Michael
give it a
Phelps
go.
like made it super popular.
Oh, is he the one who put it on the map? All right.
Yeah,
Yeah.
yeah. And it's, and everybody's like, they don't care about it anymore that the marks are there. They're like, whatever, I'm going to get it done. Yeah. But if they're going to a wedding, they're like, wait a minute. Like, I'll do it after
Maybe
the
we
wedding.
go together.
Yeah.
All right.
Let's do it. Next question I have, someone asked, I've heard
Sure.
people get massages for TMJ and migraines. How often should I get these massages for these issues to see results?
Okay, cool. So this was a great question. Yeah, that's something that I offer. That's something that tied in with the dentistry history that I have. The TMJ massage, I treat like the muscles, the outside, the masseter, et cetera, jaw. And also just took a class to also treat within the mouth. So treating a couple of areas, like literally putting gloves on, going inside the mouth. So if you're icked out about going inside the mouth, it's not for you, but it helps, your head and neck and jaw, everything's connected. So it was just a really cool class. I just enjoyed it. And I don't know really what else to say about it. I mean, everything is just so interconnected.
How about
And
migraines? You use massage,
like more of a cranial sacral type of, when we're born, our skulls aren't fused together.
Yep.
So then the cranium and all the sutures. So it's kind of treating that area with it's a light work. Okay. It's a very light work for the
migraine.
Yeah.
Migraine is one of those that when we see, it's one of those that people just don't. I mean, a lot of what you do is stuff that in traditional healthcare, the doctors have no answers, like
Right.
chronic back pain or migraines, right? When's the last
It's like
time
hit
we
or
had
miss if you get a med that works.
always.
Yeah.
So that's good. And I remember I would read research that was like different types of massage or touch therapy, different types can affect migraines and treat them better than traditional medicine. But it's very variable. Like it's not as prescriptive. Like some people respond really well, some don't, whatever.
Yeah.
But that's interesting.
I think it's really the client or the patient's ability to be open-minded to the therapy working for them. If they're coming in and they have a closed mind, it's just not going to work anyway. And for some people, it's a gradual process. They have to break through some barriers to like allow someone to trust someone to do that work for them. So, I mean, you know that as well.
Yeah.
Like, you already know the answer, but if they're not willing to accept it or receive it, then it's just not the right time for them, or they need another. I don't know.
Yeah, that's you want to know how true that is?
Yeah.
Half the time patients come in and they ask something when I'm answering it.
Yeah.
Like I'm halfway through the answer.
Mm-hmm.
They're like nodding and they're like, no, I know, doc, I know.
Right. They're not really listening at all.
And then you're like, okay, they're like, yeah. And they just needed like, because subconsciously they know, but it's because they don't have the right frame of mind. They don't want to, because you could know the right answer, but it's just as useless as not knowing the right answer if you're not accepting the right answer.
Exactly.
So the acceptance, also known as open-mindedness, is actually more important than getting the right answer. Being open-minded is more important than getting the right answer, because if you're not open-minded, you won't accept it, right? And so you could have all the information, all the expertise in the world in front of you, but if you're like, no, it's useless. So you're right on, and we see that all the time.
Yeah,
for sure. Next question, someone asked, postnatal massages sounds amazing, but is it safe to do right after birth, especially if I've had a tough delivery?
It would be advisable to listen to your doctor. I've had some clients and they're still like maybe leaking a little bit after cesarean, especially. I'm not going to treat them, not until that's done. And then I do ask them, like, I tell everybody, even if I know my clients they have that same spirit like me, like they're like, I'm just going to go ahead and do it kind of thing. But I do tell them always, like, talk to your doctor about this first. And I will tell them I'm not going to touch you until like, 2 weeks later or whatever it is. A lot of times with births, like if they're doing it the right way, you are going to get like a pretty tough massage sometimes to kind of get things, moving back around. But that's what the nurse will do. I'm going to leave everybody to what they need to do.
Yeah.
Yeah.
How young, do you ever have like pediatric clients?
Yeah, I do.
And what are they?
Yeah.
Are they like teenagers, athletes?
My youngest client is like probably 7 years old. He is an athlete. He plays soccer.
I thought you said athlete.
He's not a big soccer guy.
He's just the cutest kid. But their parents have to be present the whole time.
And it's just general, or is it like there's a specific issue with the kids?
It just depends. I don't take a lot of children clients actually. Like I have to really, think
Know the
like,
family,
okay,
be
yeah,
comfortable, yeah.
exactly. Yeah, I really just don't. So that's just that's just my thing.
Yeah,
You know.
I understand.
Yeah.
Yeah.
Gotcha. Next question, and we talked about this a little bit earlier. Can you tell me more about sound baths and what a typical session looks like?
Ooh, sound baths. That's fun. I'm actually gonna like delve more into that like this year actually. I like to think of it as just another great alternative way of healing your bodies. Everyone heals differently. And so the frequencies are kind of what you're allowing another one of your senses to take the lead, and I like to have clients like set their intentions. They don't have to tell them to me, like at the beginning of their treatment, like, where do you want to go with this treatment? How do you want the rest of your day to go? And so for myself, like personally with sound bath, I tend to choose frequencies that are going to help to bring certain things to me that I want, like we say, like manifesting, and we want more abundance. So it's kind of like a meditative type of work. I have not really done a lot of sound baths, so I'm not really going to like elaborate on that at this time, but I do use a lot of like sound therapy for myself and meditation.
Awesome.
How often do you meditate
Yeah.
yourself?
I
Do you do
used-
it every day?
I used to do it like 5 days a week.
Okay.
Lately it's been a little crazy, but
How long when you meditate? How long do you meditate?
it's like 20 minutes.
And what kind,
Yeah.
like, what do you do? Like, do you just sit in a quiet room, or do you?
Oh
have, like,
yeah. Like
sound?
it has to happen like first thing in the morning,
Okay.
because after that, like, you
Right.
know how that goes. Like the whole day is just full. So, yeah, it's quiet. It's usually literally right after I woke up.
Okay.
Yeah. And I just kind of, I typically have a guided meditation, honestly. I
Like,
find that,
like through a Spotify or something?
yeah, exactly.
Okay.
Like an Apple Music, like I'll just pick something,
Okay.
and it doesn't always have to be someone saying anything. Could be
Okay.
sound instead, but I do find like that helps with the mental clarity.
Yeah.
For
And
sure.
your day is different on those days,
Mm-hmm.
right?
Yeah. I don't know if you've tried the Apple Vision Pro.
I
But-
haven't.
Yeah, but I'd recommend.
Do you know what that is?
I think I see Jad in the living room. Like, is
No,
it the thing you put on
that's
the head?
VR.
Oh, okay.
Yeah.
This it's crazy. It's
What
like,
is
it's
it?
like a VR
Insane.
kinda.
Okay.
Yeah.
You just wear it and
Wear it on your head?
wear it on your head,
Mhm.
and you can control like any app thing. Like, and
You
it
use
just,
it just
crazy.
uses your eye movement to control it, and
So how would that inform the meditation?
it has a meditation setting
Ah,
that is
okay.
like out of this
Like
world,
immersive.
like super immersive experience.
like
yeah.
we gotta go. I'll bring
Yeah.
you to the mall one day
Okay.
to do. It's like a 15-minute virtual tour. They
Take
do.
him to American Dream.
Yeah,
Like,
well, we'll go. We
yeah.
in Paramus, we're right by GSP.
yeah.
So I'll take you one day, and you'll do a tour. It's crazy.
Oh,
Do
yeah.
them.
Insane.
Take him to like check out the meditation part and
Yeah.
like the dinosaur part. Do you like
The
dinosaurs?
dinosaur, yeah, like there's a dinosaur like right in your face. It's crazy.
So
I
you
thought that thing
tried
was
it?
gonna try
I
to
tried
bite
it before, yeah.
me.
It's cool.
It's really cool.
Diana, have you tried this? No.
I thought it was gonna be like a jump scare with the dinosaur. I was freaking out like internally. Like,
So we should try that then.
Yeah, for sure. Someone asked, how do I figure out the best skincare routine for my skin?
Skincare routine. Skincare was like a newer thing that happened to me. Like I was taking care of my skin, but then I really got into it. So, a skincare routine, you really have to like get to know your skin. Do you have dry skin? Do you have oily skin? Or do you have combination skin where some of your skin's like oily or, dry? So that's really the best way. I mean, you can ask, of course, a specialist, dermatologist, esthetician, what's best for you. If you're suffering with a lot of acne, you'll need a specialist. But typically, you're going to I'd say, go for something organic, go for something clean product, and do your research. I think that's really the number one thing for finding like the right skincare routine.
Nice.
Yeah.
Do you have a skincare routine, Mo?
I just wash my face in the shower.
With
Just
what?
soap and water?
I have a CeraVe face wash.
Okay,
my mom
good.
bought.
He's like,
Yeah.
Like I used to use
You're-
moisturizer all the time, but it's
Yeah.
like in the like rushing, trying to get to work. I'm like,
I just,
How about sunscreen?
I say
sunscreen I use.
Yeah.
Sunscreen I use, but like sometimes I get lazy with it
Yeah.
because I don't burn easily.
Yeah.
You just soak it up.
I just soak it up.
Really?
Yeah. Yeah.
Yeah.
I've got
Yeah.
burnt one time in my life, and ever since then I was really
Yeah.
on my sunscreen game. Next question we have, someone asked, what are some easy self-care practices I can incorporate in my daily routine without a lot of time commitment? I feel I have no time to myself.
It's a good question.
Yeah, that's a perfect question for Americans.
Yeah. Exactly. Yeah. It wouldn't be asked in Spain.
Yeah, again, like with the meditation, again, with if you're a spiritual person, prayer for 20 minutes in the morning, that literally is the kickoff for the day for me. You could do something simple like going for a walk for 15 minutes just so that you're able to enjoy earth and nature, the gift that you're given. And for me, my ideal morning would be morning meditation, and then right after jumping in the pool. And then I have 8 a.m. morning meetings, like business meetings. So that's how an ideal morning goes for me. And when I do those two things, like everything changes. And it's like I literally said I'm in control of my day. So if everyone did that, I think there'd be like a lot less accidents throughout the day, a lot less, dramas. It's a powerful thing to like take control of your day by just using 20 to 40 minutes to do something for yourself, to put back into yourself,
You ever
Sure.
heard of the term grounding,
grounding. Yes.
like with the earth?
yes.
You ever heard of it?
I heard about it on a podcast.
What do you think of that?
I think that's phenomenal. I think, take your shoes off, like be in the forest, be out on, even if you just go in your backyard, or if you don't have a backyard, go in your front yard and just find a patch of grass and just put your feet down and just get a feel for, the dirt under your toes, and like go touch a tree. Like if you wear glasses, take your glasses off and just look at the details of the tree. Like that's amazing little tiny things that help you to get back in tune with, with yourself and with
Yeah.
nature. Yeah. I think it's healing. I think you soak up energy,
Yeah.
like the sun's a gift. Like, why do you want to be stuck inside all day?
Yeah.
For sure.
I
agree.
Yeah.
Last question I have, someone asked, can you explain how massages can help with things like stress or chronic pain?
Yes, absolutely. Yes was my answer to this one. Massage is just absolutely phenomenal. It just really helps you. Touch therapy is just a magical gift.
Sure.
I mean, it's been the gift throughout centuries and generations. And touch therapy is a gift that I got from my mother. People are like, your hands are magical. And I'm like, that always kind of makes me remember like being very small and like laying next to my mother, and like she would rub my arm or rub my back. And I was like, I wish it's something that she had gotten into, because like it would have been awesome to have like a mother-daughter business. And she's just really great, but I don't think she can be serious enough, like minded with a touch therapy to do it, unfortunately. But it's the way that families connect, in a healthy way. And I love what I do.
What's your like favorite type of like massage, like from all over the like world? Like what tradition, or like? I
don't think I've actually tried my favorite type of massage. I think it's like still out there and I have to go find it.
Gotcha.
Literally. Like I love all holistic therapies. So like for me, I get acupuncture once a week and self-care. So it would be a combination literally of acupuncture, fire cupping, and a nice, I don't know, stretch therapy. And
Do you do yoga or Pilates or anything?
I have done Pilates. I haven't been doing it lately. I have like 10 classes waiting for me.
Right. Exactly.
I'll do a lot of stretching. Like I do mostly a lot of stretching in the pool, because that just is, I'll put like ankle weights on in the pool and I will just like go to it town with that, because
is that your workout?
That's really my
That's what you do,
workout. Yeah.
Yeah,
So I'm always encouraging my clients. I'm like, I know you guys are sitting all day. You're sitting at desks. Like your legs and your hips are weak. I'm going to be honest. I don't say it like that, because everyone's so sensitive nowadays. But, I'm like, if you have a pool nearby, you might want to think about jumping in it for 20 minutes and stretching. And like, that'll really help your chronic back pain, like
aquatherapy.
I love aquatherapy.
Yeah.
Mm-hmm.
That's great.
Yeah.
Excellent.
So that was a great
That
was
was
a great
awesome.
session, huh? That was fascinating. You do some awesome work, and I can't wait. Me and Mo are going to come by and try it
Oh yeah, for
when we
Some
have
couple.
sure.
time.
Yeah.
So Mo, you're going to put the details for
100%.
everything, right?
100%.
And
Yep.
want to thank you for taking the time and
Yeah.
educating a lot of the folks that listen and watch. This was awesome, and hopefully, as you kind of grow and develop what you're doing, which I know you're going to, we
Mhm.
come back and we could touch base again.
Sure. Yeah.
Okay.
We'll
Thank you
come
for your
back to the
time.
sound
Yeah.
bath there. Talk.
Yeah. Go deeper on sound
I'll
bath.
have answers.
Yeah, for sure. No, this was great. Thank you.